Okay, so from diagnosis to then when I officially, first day on the radiation bed, for me was about 6 weeks.
Probably about 4 weeks before I went to see my specialist.
They operated on Alan before the chemo and before the treatment, so
there you go.
about
So it's
2 or 3 weeks till the operation, and
3 odd weeks.
And then about 5 or 6 weeks they started the radiotherapy.
Even though 6 weeks seems like quite a long time, because the anxiety in that period is, I just want to get started. In actual fact, that 6-week period is you are busy, because that's when you're actually going through what they call the staging, and it's when they're doing all of their investigating, and it's also then when they start planning what your treatment sort of regime is going to consist of. So within that period of time, you're having CT scans, you're then in having PET scans. I then went into hospital for a day procedure where they did another gastroscopy to have a look. My surgeon wanted to look himself.
I had tests which were sort of a little bit inconclusive, and he wanted to get more information to work out what the treatment would be. So he did an exploratory, which is a laparoscopy.
Had a laparoscopy treatment so the surgeon could actually look inside my body and decide what plan that they would take place. I didn't fit plan A, so they had to look at plan B and possibly plan C.
They will get you to lay on the table that you're about, the radiation table, and they give you little tattoos, so because they want to make sure that you're perfectly in alignment every single day that you arrive, so that they know that that radiation that they're going to be using to fight your tumour is directed directly at where it needs to be.
The time goes. It does go quicker than you think.
Every single cancer situation and diagnosis and everything is unique. Some people may not have chemoradiation, some people may not necessarily go to surgery, some people may only have chemoradiation, but my treatment plan consisted of all three.
Richard did not react well to the initial treatments prior to the operations, so he would be struggling to keep fluids in, and I would have to keep monitoring temperature to make sure that there was no infection or reaction, and probably every week I'd be taking him into emergency for fluids to rehydrate him, mainly because he couldn't get enough fluids into him.
So they removed my esophagus, quite a lot of it, a bit more than they were planning on, and then they had to modify my stomach. They had to make my stomach into more of a tube and raise it up to where they took out the esophagus. So it was as simple as that.
And I was lucky because I was operated from the abdomen up rather than through the ribs. So I didn't have any broken bones to contend with, but I did have a big zipper down the middle, and it was a bit of a shock really how extensive all the work was. Yeah.
It sounds a really massive operation, and it is. The time in hospital was only about 8 days. It wasn't very long. They're incredibly skilled, so pain levels were all under control.
You feel like there's no end coming, but it does, and then the recovery time starts. So that's important, because once they take out all the tubes and everything after months, then the recovery starts, and that's another journey in itself.
Carers are the ones that slip under the radar, really. As patients, it's a lot of it's automatic. You're in a system, and you're being treated. carers aren't in that system really, or they certainly weren't then, and but they're vital.
You don't plan to be a nurse, and you have to be, as treatment progresses, you become more and more not just the emotional carer, but you take on responsibilities for health requirements that you never thought in your wild dreams you'd be responsible for.
My parents were my, absolute rock and my absolute sort of caregivers during that time, which is quite funny because I came home to visit them for a Christmas vacation from New York.
Until he starts the chemo and the radio, the normal care is just to be there, wash, clean. I was crazy about cleaning everything, no infections or anything like that.
Yeah, you wouldn't be able to fend for yourself when you're at home, particularly when you are having the tough days. Having somebody as a carer as such, or just someone there to help and support you, it's so vital.
They're always looking and they're always worrying, and they're the one that carries that worry and gives all the support. So I think they have a very difficult time, and they really need to look after themselves and take time out.
We all hear the same things, like you need to look after yourself and
but what does
whatever.
That actually mean?
What does that mean?
What does that actually mean?
I think you do need to work out someone that you can lean on, and you'll lean on them in a way that works for you. So is that someone that you need to just blurt everything out to and just vent it with them, and you want them just to be a listener? I had someone, a female friend like that, and she would be there, but we didn't have to talk. It was just that being there.
A carer needs to have their own person to go to. Like I would go to Norm, I think a carer needs to have someone that they can go to outpour their emotions or their worries or their fears.
I think I learnt stoicness is not about ignoring how you're feeling. It's not.
You can be strong,
You
but
can
weak.
be strong, and you can reach out to people. It's not. That's not being weak.
And I think
It's
recognising
being strong.
I think you do need a team, that the carer shouldn't just be one person, that it does need to be a team, and that even if there is one main carer, that they need the opportunity to be able to step out, have some time to themselves, go to the gym, go and have a coffee with friends, go for a walk, do something, and have somebody else there that can step in for that time.
Alan came home with the JPEG in, which I'd never even heard of before. I had no idea. They literally put the JPEG in. He had a bag of chemo attached to his side with the line going in and the JPEG, and I would have to fill up this drip system. Feeding system whenever it was required. Had no idea what it was, and I worked it out.
When I came home from hospital the first day and then the first few weeks after that, I was on a walker, which was a bit confronting for me because that's what my mother does on the walker, not me.
I mean, everything's new. It's a new normal. So you slowly start reintroducing some foods. Some aren't going to work.
My advice that helped Norm and I with caring, or support more than caring, was to be honest and trusting, so that Norm didn't have to worry that I wasn't telling him how I felt, or worry that I had pain, or looking to make sure that I wasn't cringing at different times. So I said, look, I promise you I'll tell you if I'm not right. And I think that was a great thing to set up, and we've kept that going all the time.
It's both ways. It's about understanding your own needs and their needs as well, about who are the important people in your life at that point and what you need them for.
It's a slow sort of process, and it takes time, but you just sort of muddle through and get there.